Hello, this is Optimum Health For All. My name is OJ Odia.
Optimum health for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
As usual, we're going to talk about another health concern, another health issue. Today, we are talking about diabetes. We've talked about diabetes before in some of our earlier episodes, but this time we're talking about tips for those living with diabetes. What are the health tips that we think we will benefit from? And who better to give them these tips than consultant physician, endocrinologist, which also specializes in diabetes and thyroid disorders and similar disease conditions. They talk about endocrine, diabetes, metabolism. We have Professor Chinenye. Professor Chinenye is a diabetologist, that is somebody who specializes in diabetes. He was one time president of the Nigerian Diabetic Society, the association.
Yeah.
This reverse branch or national. Okay. So he's in a good position to talk to us about this particular topic of tips living with healthy living with diabetes. So, Prof, you are welcome.
Thank you, sir.
So, like we said, this is for our viewers and mainly those who are not medical experts, those who know who may have these conditions, who want to know what they should do about it and how they can maintain a healthy, relatively normal life, but still living with diabetes. So, Prof, what is diabetes?
Well, welcome to Optimal Health. It's a platform that I'm delighted to be part of this morning. So today, as been said by Professor Odia, we are talking about healthy living with diabetes. What is diabetes? To the layman, when you say diabetes, they look at it as if sugar in the urine, but it's not really. And beyond that, diabetes is a medical condition that is characterized by persistently high blood sugar, not really urine sugar, high blood sugar. And it leads to disturbances of carbohydrates, protein, fats, vitamin, minerals, and water utilization.
Virtually all foods,
all the nutrients.
Yes.
And resulting from a defect in that organ called the pancreas, which is unable to produce insulin or produce insulin that is not effective.
Not sufficient.
Yes. So that is basically what diabetes is all about.
Okay.
Yeah. So it is not just that the best way it is high sugar in the blood, not urine sugar.
It sometimes spills into the
Yes, of course. When blood sugar is very high, it can spill into the urine. Yeah, but the defect, the abnormality is in the blood. The blood, yes. Of course, as a result, this high blood sugar can be converted to other toxic substances that can damage internal organs, the heart, the brain, the kidney, the liver, the nerves. And of course, when these organs are damaged, you can be sure that life is compromised. And that's why we need to tackle it so that people can live well with it. So that's what diabetes is all about.
So people, how is the diagnosis of diabetes made? What are the features, these symptoms that one will experience, for example? I'll say, this is likely to be diabetes. And then they may not have to go to hospital and see maybe more tests will be done before we not say they are diabetic or not. What are these features?
there are internationally agreed features for recognizing diabetes. First, the symptoms, because when blood sugar is very high, the individual can manifest some symptoms like maybe excessive intake of water and also passage of large volume urine frequently, and also being too excessively hungry. But let me say that an individual that have diabetes may not manifest these overt symptoms, and it may only show when you look at the blood, or the individual may continue to live with it and they now present like a silent killer that is presenting for the first time with a devastating complication. So to recognize it, there is a level of blood sugar that can be dictated by any routine lab. And the blood sugar can be measured in milligram or it can be measured in millimole, but in our setting here, millimole. So you wake up in the morning and you check blood sugar if it's up to 7 millimole and above, or you check it at any time and you're getting up to anything 11.1 millimole and above, or you check it even 3 hours after meal and you're getting anything up to 11.1 millimole and above. If there are these symptoms like I mentioned, like excessive urination, drinking too much water, feeling terribly hungry, one reading is enough. The individual can be labeled as having diabetes. That is standard diagnosis. But where these classical symptoms are not there, you need 2 readings.
Yes, you have to recheck.
Yeah, you have to recheck on another day, maybe the next day. And once it is elevated to that level, then the individual is said to have diabetes. Of course, something has to be done immediately. In our environment here, actually, we see a lot of diabetes patients who present without any symptoms. They just come with complications.
Okay.
Yes, and some of these complications may be already devastating, either kidney involvement or come with a diabetes sore, which can lead to amputation.
Okay, so they may have no symptoms or they may not recognize the symptoms.
Yes.
So we have to prompt them to come to hospital. But they may say, for example, I drink too much water while that's how with my family, we are always very thirsty. People can dismiss those type of early warning signs.
Yes, maybe out of ignorance.
Not out of ignorance. Yes. Maybe passing urine frequently, you say, maybe it has the nitrate. All that things that may mimic or confuse somebody so that they may not go to hospital with that. So assuming they never get to hospital, what do they do?
Usually when they come to hospital, in addition to asking them for some symptoms, the individual will be tested. And once it's tested and it's established, then they need to be placed on treatments. And there are actually 5 ways of going about treatment for diabetes. But let me also say, one is that they need to classify what type of diabetes that individual have. We have one called type 1, which tend to occur mainly in children. Most of them are below 15 years. And even in our health facilities, even in Port Harcourt here, we have a diabetes clinic for children in the pediatric department. Now, there's also another one we call type 2, which occurs in adults, and that's actually the biggest. In fact, over 90% of people who have diabetes have type 2.
And type 2.
Yeah, that's actually the big one. That is when you hear about the burden of diabetes, it is type 2 diabetes. There's also another type which can occur in pregnancy. And unless you screen for it, the woman may come down with stillbirths or death of baby in the womb without knowing the cause. And that's why these days now, every pregnant woman is routinely screened for diabetes. There are also the type that can occur as a result of other diseases in the body. Now comes like secondary diabetes.
Okay.
But like I pointed out, the commonest is type 2.
Type 2.
Yeah,
Okay.
type 2. Mainly occur in adults. And there are also going to be family history, strong family history.
Yes.
Might be able to trace maybe on your father's side or your mother's side.
Or
Be able to, yes, or both sides, and now say, oh, this person is living with diabetes. Yes, sir. So there is an element of hereditary in that type 2.
Okay.
Yes, yeah.
So there's treatment.
There is treatment.
So what do we do? You said there were 5.
Well, there are 5 approaches we usually undertake to treat them. 1, every diabetic patient must be monitored. Monitoring is very important. Even the patient will be taught how to monitor him or herself at home.
Okay,
That's monitoring means they have to check their blood sugar at home.
Okay.
When they also come to hospital, we check their blood sugar and do some other tests.
I also compare with what you got at home.
Yes, and what they're also getting in the hospital. Other than blood sugar, we also check their cholesterol, because at times people living with diabetes can also have high cholesterol. We also check their blood pressure, because a lot of studies have shown that up to close to 70% of people who are living with diabetes also has high blood pressure.
Okay.
So when you see the other one, you check for the other. Yeah, because it's always said that one follows the shadow of the other. So when you check all those things, these are all part of monitoring. But most importantly, they must be taught how to check themselves at home.
Okay.
So that even when they are coming for checkup, they now bring their home readings for comparison. That is 1. 2 is education. The person living with diabetes need to be educated about the illness. There's something we call diabetes self-management education. Usually, when a patient is newly diagnosed, there are nurses, there are other health workers, including doctors, who will take you through
what to do.
What to do.
Okay.
So that aspect, even publish some small pamphlet on how to educate patients who are living with that. So that was very key. Very key in the sense that most times the diabetic patient is only with the care provider 5% of the time.
Okay.
So 95% of the time they're on their own.
Okay.
So what they do on their own matters so much.
Okay.
So self-management education is very important.
So
3 is diet.
Okay.
Diet is very, very important. Usually in the hospital, it's a multi-discipline. We have the dietitians who also work with the doctors.
Okay.
But most importantly, the diabetic patient need an adequate diet.
Okay.
Like I said earlier on, there are 6 nutrients in the human body: carbohydrates, protein, fats, vitamins, minerals, and water. They all need this in the right proportion.
Okay.
It is not scientifically wise to sentence a diabetic patient to be some plantain. No. You need all the nutrients in the right proportion.
Like they also have carbohydrates and protein.
Exactly. So you need all of them, So of course, the dietitian usually will put them through.
Oh, yes, and what to do.
Yeah, need them usually what proportion to take and prepare the menu. In terms of breakfast, lunch,
And they are available.
yes, and even dinner, yes, and even in between snacks.
Yes.
Most importantly, based on locally available food. There is nothing called diabetic diet per se.
Okay.
Use where it is available. Exactly.
So I talk about what they take in Britain or what they use in America.
Yes.
So we're talking about our own local environment.
Yes, local environment. Yes. Anywhere you are. In Africa, here we have quite a lot of good food in our environment, which can serve the need of a diabetic patient. The next one is exercise. It's often said that diabetes is an exercise deficiency state. So those of us who have diabetes must learn to do exercise. I'm not prescribing that kind of endurance exercise, just aerobics. The exercise has to be regular.
So what do they do?
The best form of exercise is take a walk.
Okay.
Maybe ride a bicycle.
Ride a bicycle,
swimming,
brisk walk.
And it has to be regular, at least 150 minutes a week.
Which is like 30 minutes.
30 minutes a day for 5 days, or 50 minutes 3 times a week. Very, very important. It helps. And in fact, the benefit comes when you do it regularly. Memory rest, do it regularly.
Okay.
And that's when the benefit actually comes. Exercise is very, very important.
That will also cut down the weight.
That also helps to cut down the weight.
The availability of
even makes the natural insulin more effective. Yes. And also help to help the muscles to mop up the nutrients in the body. Then the next one is the medicine.
Okay.
The medicine, because it has to be emphasized that by the time diabetes becomes obvious, that individual living with diabetes may have lost up to 50% of the pancreas.
Okay.
Well, 50% of the pancreas is no longer working.
Not working.
So the remainder need to be supported with medicine. Medicine, yes. And we have quite a lot of medicines with the injectable, the tablets, and so on and so forth. Of course, with the doctors have to prescribe. Like those of us who are living with type 1 diabetes, usually children, they are placed on insulin injection.
What
Yes,
they will need.
that's what they need, because most times they can't even produce insulin. So they have to be placed on insulin so that they can grow, achieve puberty, and live normally. Yes, and they,
Insulin is prescribed by the doctor.
well, this will be prescribed by the doctor. You look at the weight of the patients and then determine the proper dose. And like I said, it is the doctor that has to prescribe insulin, and insulin has to be properly stored.
Okay.
Because most times you see people put insulin on a dry shelf.
Okay.
No, doesn't make it effective. It has the nature, exactly. No, so
insulin is protein.
this is a special protein which has to be stored under a particular temperature. Yes, so to make it very, very effective. And luckily these days we have exactly the insulin from the human body. Not insulin from the human body, but the science has led us to need the molecular structure of the human insulin. So it can be in the lab
to mimic human
insulin, and it's quite very effective.
Very good.
Other than that, there is also tablets. Like those of them who are living with type 2 diabetes. Most of them is like in type 2 diabetes, it's like the pancreas is asleep. So you need the tablet to stimulate the pancreas so that the pancreas will work and produce insulin. And there are quite a lot of them now available, affordable, which patients have to use. Exactly. And again, it has to be regular and consistent.
As prescribed.
As prescribed. It's not enough to take for 1 or 3 months and say no. Usually, the treatment of diabetes is for life.
Okay.
And that should not scare anybody. Yeah.
We do a lot of things are for life.
Oh, yes. After we eat every day.
Every day for life.
So,
one of the things.
Yes.
Everything is for life. So most of the things we do, we were targeting to the end of time.
Yes.
End of our own time.
Exactly.
Okay.
Yeah. So that is how to go about the treatment. Like I said, you can see, but with all these 5 steps I've said, now you can see it's like other care providers are involved. The nurses, the dietitians, the doctors, the physiotherapy, so that at the end of the day,
And the patient.
in fact, the patient is the king.
Yes.
The patient is the king actually here, because without the patient, no meaningful treatment will be implemented.
And
But
patient has to cooperate.
Yeah, but have to
Has
cooperate.
do what to do
Yes.
and do some tests by himself or myself at home.
Yes.
Okay, so this patient have way of testing their own blood sugar.
There are meters now. There are what we call glucometer, which are sold all over the place.
Available.
Available and affordable,
Okay.
and the patient can use it
And
to
test
check his or her blood sugar at home
and then be able to
and keep the record.
Yes, keep the charts.
Yes.
So that we know whether they're well.
And even he can use it to titrate his or her treatment.
Very good.
Yes, in accordance with the doctor's advice.
Okay.
Mm.
So we have given us some of the tips now from explanation you are giving us so far. So now that the patient knows that he or she is diabetic, he knows what to do, he has been advised and whatever. Complications can also occur. So how can the patient prevent onset of complications?
First is that these patients that really keep to their management protocol regularly, they usually don't develop any complication. In fact, in our practice in Port Harcourt, we have patients that are in their 80s and 90s. You see? That thing, doing very well, no complication.
They are well controlled.
Yes. Usually, those of them that come with complications are patients that fail to do the right thing.
Okay.
And some of the complications, like in our medical ward here in Port Harcourt, we see a lot of patients coming with diabetic sore. And the wound on the body of diabetic patient is difficult to heal. So that we call it diabetic ulcer. And these ones, by the time they come, it is late. So that is what, and it can even lead to what we call gangrene, which is like the affected limb can die, and which the orthopedic surgeon can now come in and amputate.
We don't want that.
We don't want that, exactly. That's one complication. Another complication also is the affectation on the eyes. In fact, in Nigeria now, or in most part of the world, diabetes is the commonest cause of blindness. No longer even blindness as it used to be in those days.
Yeah.
Then I will recommend regular eye checkup. There are eye doctors that are specialized in caring for diabetes patients. So have to regularly go for eye checkup. Yeah, particularly when the inner part of the eye called the retina is being affected, or even the lens.
Okay.
It can be detected. And that's what they call cataracts. That's also what we call retinopathy, means the inner window of the eyes has been damaged. But if it's detected early, there are treatments
After that.
for it. So that's one complication.
Okay.
Another complication is also like damage to the nerves. They start feeling like pin and needle sensation. Even for the men, nerves that control erection can be damaged.
Okay.
And they now develop what they call erectile impotence. That's also that's also one complication. Then other complication that it can affect the heart. There is what is now recognized as diabetic heart disease. Can even cause heart failure. These are some of the complications. But like I said, those of them that are well treated usually don't go ahead. But because in the diabetic heart failure setting, we usually will involve cardiologists who now come in to manage the patient, and usually with proper management and of course controlling the blood sugar.
People are involved.
Okay, yes, lot of people are 80 years. Another thing also is stroke. Diabetes can cause stroke. Patient now come with either paralyzed one part of the body or unable to talk. And usually again we bring in the brain specialists who we call the neurologists, who will now come and manage what we can do. So diabetes can affect every tissue in the human body, including the skin. There are special skin conditions that diabetes can affect, and we bring in the dermatologists. Even the hairs on the body can be. So it's almost like this illness is the disorder of the very engine of life. You know? So, but like I said, with good treatments, some of these complications will not set in. If any of them set in, it has to be recognized and
very quickly. So the crux of the matter is that there should be preventive strategies. So if you are managing, controlling the diabetes, you are preventing complications. Okay. So, and the patients are the center of it, because he can do self-monitoring. You can also see when other symptoms are developing. He needs to go to hospital, keep his appointment from time to time as required. Okay. Prof, thank you very much. Are there any other tips or any other advice you want to give to those people living with diabetes?
Yeah, I think the advice I have to give is that one, diabetes is not a death sentence. Today, there are life transformative treatments. And when you embrace them, you will live long and live your quality life. I think the only to say 3 square and a half, and I can tell you that you can live beyond 3 square and a half.
There are so many
with diabetes, that are 80s and 90s. And then again, actually, you see, in our environment, we see a lot of alternative care providers that make some pronouncements that are really not true. Well, if we have a care for diabetes, all those guys, it is not true. Yes, there are scientific moves to see whether we can find a cure for diabetes. But you see, some of these things, until they are proven, they are not available yet. So please go for the life transformative treatment that are available. And don't be deceived by people that make bogus claims. Exactly.
For the diabetes to go to hospital.
Yes.
Okay. Thank you very much. I think we have we've exhausted.
We've actually exhausted all the distance.
Thank you very much for coming. Viewers, this is Optimum Health For All. Thank you for viewing. Please subscribe to our channel and share this video as widely as possible so that many people will benefit from the information that is contained herein. Thank you very much. Bye for now.
Optimum Health For All, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's Optimum Health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. We thrive, we shine with every routine. Optimum Health, you know what I mean. Optimum Health for all.